President Biden now says every American will be able to get a COVID vaccine by the end of July. So far, more than 39 million people in the U.S. have received at least one dose. And the Navajo Nation, which less than a month ago had the country's highest rate of deadly infection per capita, is now making strides to vaccinate its population. Zoreen Shah has more on their ramped-up rollout.
In the heart of the hard-hit Navajo Nation, a community praying for normalcy.
I hope that we can get back to normal. I want to see my grandkids again. I want to hold them. I want to hug them again.
The area that's the size of West Virginia, that spans much of Arizona, New Mexico, and Utah, is one of the few minority communities blazing ahead when it comes to vaccination efforts. At least 25% of people now have their first dose. Part of that effort is trying to keep a piece of our country's culture from slipping away.
Within all Indigenous communities around the United States, unfortunately, COVID seems to be hitting the elders the hardest, and the elders are the keepers of the tradition of the languages. Not a lot of the youth speak Navajo or, Dene or many of these other languages that come along with being a part of an Indigenous tribe.
Goldstein is an area director for Core Nonprofit, a group that embedded in the region last May when COVID rates were soaring, partnering with Johns Hopkins and community leaders, youth advocates, and traditional healers in the race against time to reach out to as many people as possible. The vaccination approach dramatically different from smaller cities.
Part of the complication that we are facing and the challenge is just physical access. So many people by choice and through tradition, they live kind of what would be, from my perspective, considered the middle of nowhere, but for them would be considered, on their ancestral lands, and it's where they want to be. So the result of that is sometimes people have to drive 3, 4, 5 hours just to get to a clinic.
The mission to vaccinate folks in the most rural areas has been on medical experts' minds months before the rollout.
One of the things that makes a vaccination program so difficult in the United States is that we have such a fragmented, disorganized, and inefficient healthcare system.
Health experts, along with activists, now teaming up, holding virtual panels, hoping to tackle another challenge when it comes to vaccinating the Navajo Nation: skepticism.
We wanted to get the best vaccine that would help our people get through this COVID pandemic. And I think that sharing of information built trust. And they get a report every week from Johns Hopkins letting them know how the study is progressing.
There has been a very warranted mistrust of federal government, of people who are non-Indigenous. And some of it's obvious in terms of historically how they've been treated, how, they used to basically occupy what we now call the United States and have been relegated to these teeny tiny little swaths of land. Despite
the participation of Indigenous people in vaccine trials, mistrust and intergenerational trauma stemming from a history of communicable disease wiping out tribal communities still causes concern for some residents.
Asking whether this takes 5 to 10 years off of your life. That's one thing that I've heard.
But health officials reassuring the community that the vaccine has already been thoroughly tested.
A lot of testing was already completed with the world population in mind, and different minority groups were all tested.
They wanted a lot of the different subgroups that matched the population of the United States.
According to Navajo Nation's president, the region will hit its goal of 100,000 vaccines by the end of February. President Jonathan Nez saying the region has had several large-scale drive-through vaccinations, and more personnel and vaccines are on their way.
That was quick. We need to be very mindful and sensitive to the fact that just because we say it's safe doesn't mean that everyone is going to hear that in the same way, and doesn't mean that everyone is going to trust it right off the bat.
Our thanks to Zoreen Shah for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.